Hi there, and happy Thursday. My name is Allison Coleman, and I'm a program manager at the National Recreation and Park Association. I'm excited to be the first to welcome you today to our live webcast training completely focused on increasing health and wellness in out-of-school time programs. We're filming live today from NRPA headquarters in Ashburn, Virginia, just about 45 minutes outside of Washington, D.C. We're thrilled to have so many park and recreation professionals tuning in across the country, some of whom are grantees for our 2017 Healthy Out of School Time Programs grant, and others who are interested in learning more about the federal nutrition programs, the HEPA standards, and nutrition education. We're looking forward to a great day of learning, offering some new strategies and best practices, and hearing from some folks in the field who are implementing the different aspects of this initiative. We're also happy to answer any questions you might have throughout today's training. We'd like to extend a special thank you to the Walmart Foundation for generously providing the funding for this training opportunity today. They're a vital partner in the work that so many park and recreation agencies have done and have contributed significantly to the resources that NRPA has been able to develop over the years. We'd also like to thank a few other organizations and individuals who are making today possible. Big thank you goes out to Dr. Danielle Holler, President of Healthy Networks Design and Research. She has played a pivotal role in the creation of our nutrition literacy program, Foods of the Month, that you'll hear more about later today, as well as the evaluation of our work over the years. In addition, we want to thank the Alliance for a Healthier Generation for their continued support of our Commit to Health initiative. Specifically, I'd like to thank Ava Young and Stephanie Roberts, who are joining us today to help provide resources and tools and technical assistance to our park and recreation professionals who are working to implement these standards. In addition, I want to thank two other special guests who are joining us, Maggie Lugers and Holly Baker. They've come all the way from South Burlington, Vermont to share their story with you, and I think you'll find that their input very valuable. We have a really full and exciting day planned for you all today. We're scheduled to run until about 4:30 p.m. In addition to hearing from those presenters, we have several NRPA staff members who will be sharing sessions with you throughout the day. And I know that you'll each find this information valuable and will go home with a wealth of knowledge ready to implement into your programs right away. Let's take a few minutes to go through today's agenda so everyone's clear and you know what to expect. We'll be starting off today by hearing from our Manager of Government Affairs, Kate Sims. Kate will discuss the USDA child nutrition programs and some strategies on how to increase meals in your communities. She'll also talk a little bit about the current political landscape and some updates on policy. Following Kate, Holly and Maggie from South Burlington will share their experience implementing the different aspects of the Commit to Health program, including the federal nutrition programs. Following that, Ava and Stephanie are going to dive into the healthy eating physical activity standards. And then we'll take a quick break between 2:05 to 2:20 p.m. so you can get up, move around, grab some water, and come back ready for a fun afternoon. Later this afternoon, we will hear from Dr. Danielle Holler and go through our nutrition literacy program, the Foods of the Month curriculum. And following that, we'll have our advocacy manager, Janie Rasmussen, present on our Park Champions initiatives and how you can invite members of Congress to your sites this summer. And lastly, we'll hear from some wonderful members of our marketing team, Roxanne and Katrina, who will help share some tactics on marketing your Commit to Health programs. Again, we encourage you to ask questions throughout the day and make sure that nothing is left unanswered. So before we dive in, I want to talk a little bit about the issues that we're working to solve and what Commit to Health is really all about. So most of you are probably familiar with the fact that 1/3 of all youth and adolescents are overweight or obese. But out of that, almost 17% of youth are actually obese. And we know that being obese at a younger age increases your risk for developing certain types of chronic disease, diabetes, heart disease, stroke, certain types of cancer, bone and joint problems, things that follow you through adulthood. This can increase healthcare costs, not only for you, but for our whole country, and will diminish quality of life. Like obesity, childhood hunger is another issue that's really plaguing the health and wellness of at-risk children across the country. Over 13 million children suffer from childhood hunger in America. And while 21 million kids rely on free and reduced lunches during the school year, only 3 million of those kids are getting meals in the summer. That is a huge problem. Kids aren't getting the nutrients that they need, they don't have access to enrichment opportunities, and they struggle every day wondering where their next meal will come from. It's a problem that no child should have to face. In addition, physical activity rates are at an all-time low for kids, while digital device time and screen usage is at an all-time high. Kids are clocking in at over 7 hours per day using their screens. And they're not getting outside anymore. They're not engaged in their natural habitats or in the environment. In fact, children are spending half as much time outdoors as they used to. In addition to that, diets have changed. Sugar consumption is up. Processed foods are up. There are so many issues that these kids are facing. And this program is really all about working to change that, working to reverse those trends and improving childhood health at your park and recreation sites. We know that Parks and Recreation can be the solution to these problems, and we hope that today's training will give you the tools and resources you need to make those changes. That being said, we're focusing today's training on 4 main pieces: the child nutrition programs, the healthy eating standards and NRPA's Commit to Health initiative, nutrition literacy, and advocacy and marketing. Quickly, I want to talk about NRPA's Commit to Health initiative, as everything we discussed today kind of folds up into this broader movement. Ava and Stephanie are going to talk more in depth about this, as well as the Alliance's role in this initiative, but I want to give you a little bit of background. Commit to Health was launched in 2014, and NRPA made a pledge to the Partnership for a Healthier America to engage 2,000 park and recreation sites across the country in this initiative. We work very closely with the Alliance for a Healthier Generation on providing technical assistance, tools, and resources to our park and recreation sites so they can be successful in the implementation of the healthy eating physical activity standards. These are things like ensuring that kids have a fruit and vegetable at every meal, that they have access to water at all times, and that they're meeting the daily physical activity requirements, and making sure that that activity is moderate and vigorous. It's not only NRPA who's adopted this initiative, though. YMCA's, Boys and Girls Clubs, and other nonprofits are working on implementing these standards in sites all over the country. So we're all in this together, making these changes and working to improve the health of our children. That's really important to remember, because there are probably some partners in your community who you can link up with throughout the year to make sure that you're as strong as you can be. Just to give you a little bit of information on where we are today, NRPA has over 1,300 sites that have now pledged to implement these standards, and that's impacting over 228,000 youth across the country. Some of those kids are in your sites, and some of you will be joining this movement and adding to that number. And we're really excited about that. We've also been making some really great progress. Last year, we went through an evaluation of these standards, and we know that 85% of sites are serving a fruit and vegetable at every meal, that 95% of sites are providing drinking water at all times to kids and their staff members. And at the same time, they're prohibiting access to full-calorie sodas and sugary beverages. And in addition to that, on the healthy eating side, 86% of all sites are offering evidence-based nutrition education, which is awesome. On the physical activity side of things, we know that park and recreation agencies can succeed at these. 97% of sites are ensuring that physical activity takes place outdoors, and they're connecting kids with their environments through that. 97% of sites are making sure that kids are getting those minimum physical activity requirements of 30 minutes in a half-day program or 60 minutes in a full-day program. And 90% of sites are limiting digital device time. So we're already making progress. We're working to make these changes, and it's working in our kids. We can see those changes. Lastly, I just wanted to touch on one other topic that we're not going to go into too much detail today, but I know that you guys know that you can have this as a resource. Last year, we also developed a food waste reduction best practices guide. This is going to be really handy for your programs, especially those programs that are operating the meal programs. So make sure to download that from our website. It's on our Commit to Health resource page, and it's got a lot of great ideas and best practices like conducting assessments, ordering, purchasing, successful serving, using food donation as a strategy to reduce waste, and composting. So make sure you take a look at that. So now that I've shared some information about what we're going to talk about today, I want to quickly run through some housekeeping items and make sure that everyone's comfortable asking questions and participating in our polling feature. You'll notice that there's an image of a poll screen being displayed right now. This is an opportunity to participate in some fun polls throughout the day that'll help shape some of the presentations. In addition, in that same box, you'll notice that you can select questions to submit your questions at any time. We'll do our best to answer everything that comes in today, but if we don't get to yours, we'll make sure to follow up with you. So let's try a practice poll really quickly. We'd love to know what the weather's like today wherever you are. We have a couple of options on the screen. You can say it's 65 degrees and sunny, or why won't it stop raining? Or you might even say it's too hot for May 4th. All right, so we've got some polling coming in, and sunny in most communities, so you are some lucky people over there. We've got a couple that say it won't stop raining though, so make sure that you bring your raincoats out. All right, so we've got a busy day ahead of us. We want to go ahead and we're going to take a quick 5-minute break, and we'll be back with our very first session of the day with NRPA's Manager of Government Affairs, Kate Sims, who will talk about the child nutrition programs.